So natural foods that act like drugs, and this is where food is medicine. And in my opinion, I've seen this often. I've seen this a lot. Is that foods can be used like medicine, and it depends. I mean, I don't want to get into this part of it, but how badly do you want to lower blood pressure? And this is where the natural foods can come into play and lower this. To me, if you leave it in my hands, if you ask me if I have a problem, I'm on fix mode. I'm like, okay, what can we do to lower this? And what are all the options that we can do to lower blood pressure? And so the first thing I always like to look at are micronutrient deficiencies. If you haven't had this test, make sure you get this test done if you have high blood pressure. Why is it important? And you have this slide here. You can take all these supplements, but you're probably getting a lot of these from foods. However, you might be deficient in certain nutrients, and then it's important to replenish yourself so that you can, lower blood pressure. In this process, if you especially have a deficiency, you can take up to 6 months to a year to change micronutrient deficiencies and bring them up to par, so then it can start to then play around in your metabolism in a good way and start to lower blood pressure. So these are micronutrient deficiencies that is something very important to look at. And so again, what does the gut have to do with it in hypertension? And I just talk about it in a general side of things. Hypertension, there are many reasons why you can have hypertension. I talked about those different umbrellas, micronutrient toxins. These are all 90% of all diseases start in your digestive tract. And so this is why it's important that that's why we look at gut health. We want to make sure that your gut health, are you digesting foods properly? Or do you have any sensitivities to food? All those things come into play, because if you start to have inflammation in the gut, it can lead to the arterial wall. And the lining of the arterial wall, it's very similar to the lining of the gut. And so that's what the gut has to do with hypertension. So gut microbiome and hypertension, there's chronic inflammation that blocks angiotensin II receptors, which then can also increase blood pressure related to changes in the microbiome ratios. Pretty crazy stuff. And so there was I'm going to get into the study here. So increase in specific bacteria ratios, which induce angiotensin II, which then induces hypertension. And so lactobacilli are natural ACE inhibitors. This is biotics that produce biologically active peptides that increase ACE inhibitors. So you find this in fermented milk or sour milk and blueberries. And when you look at that part of it, there's a phenylacetylglutamine and gut metabolite, and it's negatively associated with pulse wave velocity and systolic blood pressure. So those are where I talk about these things in helping the gut side of things. And probiotics, which everyone's heard about, with over basically 1 billion CFUs of multiple strains administered over 8 weeks, actually lowers systolic blood pressure and lowers diastolic blood pressure. So just giving a probiotic to a patient, sometimes we see a lowering in blood pressure. And that's the reason why. I always want to give you the reason why. And I'm sorry for getting technical there, but I want to tell you why a probiotic works. Because if you understand why, then you're more likely to keep with it. But the more important part is that, do you have this gut microbiotic problem? And so that's what we would look at in the clinic. So what are some other foods that help lower blood pressure? So bonita proteins, marine collagen peptides. So these are natural ACE inhibitors, and it's found in tuna and mackerel family. The bonita protein actually reduces blood pressure about 10 millimeter mercury to 7 millimeter mercuries over 1 to 3 months, and you want to have 1.5 grams a day. And there's no adverse effects, and it's very cost effective. Now the common question is, what about mercury and toxins and all that part of it? That's something that we can look at. If you have heavy metal toxicity exposure, it's important to look at that heavy metal toxicity and see if you're worried about that and concerned about that. That's something that we can test. But I'm letting you know that bonita proteins are beneficial in lowering blood pressure. Brown rice. Now, if you've heard me talk about anything from a nutrition side of things, I always talk about minimizing carbohydrates, especially the simple carbohydrates. But in this case, brown rice is a complex carbohydrate, and it's actually acts as a natural ACE inhibitor and a natural angiotensin receptor blocker. And now you know where in that pathway it makes a change. And so it can reduce blood pressure in 20% in rat models when they give brown rice. Garlic and hypertension, something I recommend throughout the board here. Consistent dose depends on the blood pressure reduction, but there is a lot of trials on this, and it basically lowers anywhere from 8 to 16 millimeter mercury, having garlic a day. And so on average, like I said, 8 to 7.3 millimeter mercury in hypertensive patients. And so the cultivated garlic with the Allium sativum, it's not all garlic preparations the same, and that's something to be very important at. And so something I would recommend all our patients take for many reasons is to have aged kyolic garlic. And aged kyolic garlic, or the extract, has excellent response to cardiovascular health because it has vascular remodeling properties and it lowers blood pressure. So aged kyolic garlic is something that I definitely would like you to take as a supplement. Or alternatively, you want to have wild, uncultivated garlic, and this is probably 1 to 4 cloves a day. And I know you keep the vampires away, which is good, but this is the dosage that you'd want to have if you don't take the aged kyolic garlic. It's got a lot of great minerals in there to help lower blood pressure. It's got a lot of great ACE-like, so angiotensin converting enzyme-like properties and inhibitor properties. And it also increases nitric oxide and bradykinin, which is what ACE inhibitors do. So it's a natural ACE inhibitor. And also improves arterial compliance. So garlic has high flavonolic compounds, again, ACE-like inhibitor properties, high in magnesium, which then acts as a natural calcium channel blocker, which dilates the arterial wall. Fresh wild garlic is definitely the most effective. And as I mentioned, garlic is a natural ACE inhibitor. Vitamin D. Yes, you want to hang out under the sun a lot more. And so in the Northern Hemisphere, we lack our sun in the winter. And so it's important to get sun, but also take vitamin D. And so it's a natural lining stress reliever that basically helps minimize the macrophage activity which happens inside the subendothelium. And so vitamin D is super important to lower blood pressure. Flavonoids, you'll find them in abundance of good things, even dark chocolate, yes. There are over 4,000 natural occurring. It can actually lower risk by 8%, lower blood pressure. You'll find them in fruits and vegetables, red wine. The quercetin inside that is really what we're after. Tea, soy. Let me go back on red wine. Resveratrol is what we hear about, but in this case, from a flavonoid side of things, quercetin in the red wine is what we're after. Licorice is another one that happens from that side of things as well. Grapeseed extract, very good at lowering blood pressure. It has got a high phenolic content in the grape seeds, and basically activates the production of nitric oxide inside our blood vessels, which I'll get into a little bit. So it increases nitric oxide, improves endothelial dysfunction, and lowers blood pressure. And so how much should we have now? If you're taking this as a supplement, you want to be between 150 and 300 milligrams of grapeseed extract, which then can lower blood pressure 11 to 8 millimeter mercury in 4 weeks, which is really cool to see that benefit that way. Pomegranate juice. I love pomegranate seeds. I think they're very important to lowering and improving remodeling to the arterial wall. It acts as a natural ACE inhibitor, so it reduces activity by 36%. They're rich in a whole bunch of good tannins and polyphenols. It lowers systolic blood pressure anywhere from 5 to 12%. It's a modest decrease, but the reason why I'm after this one is because it actually improves vascular remodeling. And so this is the amount that you want to have, 330 mils of pomegranate juice a day. Now, if you're overweight, I'm not a fan of using the juice. I prefer you having the seeds. You can have them as frozen. And in that case, you want to have a quarter cup to a half a cup a day. You want to suppress the postprandial increase of blood pressure after a high-fat meal. It does reduce carotid IMT. So on the assessments that we look at, it does lower carotid intima media thickness. Again, improves nitric oxide production, reduces oxidized LDL. Remember, once it gets through that inside lining of the arterial wall, gets oxidized, increases, again, nitric oxide, decreases vascular inflammation, improves endothelial dysfunction, and a whole bunch of other things that happen that increase catalase. And there are some specific chemicals that happen inside the arterial wall, and that basically this one helps lowering, improving vascular remodeling is really what I want to get at with this one. And so it's an antihypertensive, anti-atherosclerotic. So if you have artery disease, it's one of the big things I recommend having. And it's an antioxidant and anti-inflammatory. And it's natural. It's something that we can have on a daily basis. Quercetin. I talked about this in red wine. It acts as a natural ACE inhibitor. And so it also chelates some metal ions like zinc that are present in ACE inhibitors. It also helps minimize the immune response that happens to the arterial wall. It reduces inflammation and oxidative stress. It lowers blood pressure anywhere from 7 to 5 millimeter mercury reduction, and improves endothelial dysfunction, insulin resistance, and also lowers oxidized LDL. And it reduces coronary heart disease and also cerebral vascular events as well. And it slows the aging process, so it actually acts as a natural anti-aging mechanism. How much should you have of this? 500 milligrams is the dosage that we want to have on this, or grapes, which is found in also grapeseed extract. But if you're going to take it as a supplement, 500 milligrams is where we want to be. So let's talk about hypertensive medications now, getting back to this. We've got diuretics. I talked about minimizing or coming off of hydrochlorothiazide, ACE inhibitor, angiotensin receptor blockers, calcium channel blockers, and beta blockers. These are all the ones that we have in our arsenal to lower blood pressure. Now, there are natural, so if you're on those drugs, there are natural foods that you can have that also act as a diuretic, act as those drugs. And so what I'm going to get here now is the foods that lower, that act like the same thing that drugs do. Not to replace drugs. Remember, drugs are very important early on in the disease process, but here's some foods that I want you to consider adding to your diet, especially if you're on that drug. So taurine, which I think is super important, acts like a natural diuretic. Vitamin B6, celery, lipoic acid is another one. Vitamin C, potassium, high gamma tocophenols and tocotrienols. And so here's where we see that the high gamma, so magnesium, calcium, protein, fiber, CoQ10, L-carnitine, hawthorn berry. These are all natural acting diuretics. So natural acting beta blockers, and remember, I'm not a fan of using beta blockers to lower blood pressure. I don't think that's because it doesn't change the remodeling of the arterial wall. And so hawthorn berry is the natural acting beta blocker. So direct vasodilators, things that actually open up the arterial wall. Here's a list of foods that lower, that actually help dilate the arterial wall and allow the blood to flow a lot more smoothly. Omega-3s, omega-9s, potassium, magnesium, melatonin, soy, fiber, garlic, flavonoids, the vitamin C's, D's, and E's, grapeseed extract, you can see that up at the top, CoQ10, L-arginine. And I'm going to talk about L-arginine when I talk about nitric oxide. You don't want to consume L-arginine as a supplement. Now, L-arginine is found a lot in natural foods, and so this is what I'm talking about. Taurine, pomegranate, alpha-lipoic acid, celery, quercetin, extra virgin olive oil, and garlic. Those are all natural vasodilators. So calcium channel blockers. So if you're taking a calcium channel blocker, here's the natural calcium channel blocker acting like foods. And so ALA, alpha-lipoic acid, magnesium, vitamin B6, vitamin C, vitamin E, NAC, which is N-acetylcysteine, hawthorn, celery, omega-3s. The highest source of omega-3s, people always ask me this, and I just want to get into this quickly. Omega-3s, the best source of omega-3s are found in sardines. And so if you could have a can of sardines a day, that would be really helpful. The oil in there is really beneficial to increasing omega-3s. Calcium, garlic, taurine, extra virgin olive oil, and olive leaf extract. You can see the overlap with some foods there that I'm talking about. Natural ACE inhibitors. So ACE inhibitors, ramipril, lisinopril, those are natural, those are the drugs. Now, what are the foods that can lower that? And again, you can see a bunch of ones there. So garlic again, you'll see in there, seaweed, the tuna protein, the bonito protein that was what I'm after, the sardine protein, hawthorn berry, bonito fish, phycogenol, casein, hydrolyzed whey protein, sour milk and milk peptides, gelatin, extra virgin olive oil, sake, of course, all in moderation. But omega-3 fatty acids, chicken egg yolks, zein, which is a plant protein, dried salted fish, fish sauce, zinc, melatonin, pomegranate, quercetin, berberine, olive leaf extract, and taurine. You'll see all those as natural ACE inhibitors. So natural ARBs, angiotensin receptor blockers, and you'll find this potassium, taurine, resveratrol, fiber, garlic again, vitamin C, D, and B6, CoQ10. These are all natural ARBs. Celery, GLA, gamma-linolic acid, extra virgin olive oil, olive leaf extract, NAC, which is N-acetylcysteine, and melatonin, all natural ARBs. So the big takeaway that I want you to get from this is that you want to avoid high fructose corn syrup. You want to have 2 grams of sodium intake per day. You want to limit to that. 5 to 10 grams of potassium intake per day. 1,000 magnesium intake per day. Now you want to ramp up to that magnesium, and again, we got a good brand of magnesium in our clinic. Protein, you want to have 1.5 grams a day to organic animals, vegetables, and cold water fish. Mixed fiber, 50 grams a day. Pomegranate seeds, 1/4 cup twice a day, and or an 8-ounce juice per day. And then I'm going to caveat that with, if you have weight concerns, I'm going to lean more towards having the seeds versus the juice. Extra virgin olive oil, it's got a high polyphenol content. You want to have 4+ tablespoons a day. Throw that on your salads. Throw that on different things that are be helpful. I put them on my eggs in the morning. I throw it on your proteins, whatever it might be. But that's the big ones that you want to take away with that part of it. You want to avoid artificial sweeteners. Avoid saturated fatty acids that are long chained, and trans fatty acids. We all know about or heard about trans fatty acids. You want to avoid refined carbohydrates. The DASH DO diet and the pre-med diets are ones that I want to lean towards. And I kind of like, I'm not a big fan of a diet per se, but the DASH diet, why it's important is because it has lower sodium content. And the Pretty Mediterranean diet, it's got a way of, basically, you want to minimize the refined carbohydrates in those diets. That's a big idea from that part of it. Low inflammatory diet. And the best supplements I can ask you to take, number one, I think it's so important that you have the micronutrient test, so you have that background behind you. But supplements, omega-3 fatty acids, I think that's super important. Coenzyme Q10, very important. MitoQ is the one that I recommend. I have a whole talk just on that part of it. Natural beetroot extract, which would be very important, or Neo 40, or Resync, which is a powder that we have in our clinic, or Neo 40 Professional, which we have in our clinic. Again, these are nitrates and nitrites, which I'll get into in a little bit. I have a whole talk just talking about nitric oxide, which I'll give that to you separately. Whey protein at 30 to 50 grams a day. Bonito protein, 1.5 grams per day. Aged kaolic garlic, again, you can pick that up. You can just get it on Amazon. We don't carry it in our clinic. It's just available everywhere. So 600 milligrams a day. Grapeseed extract, 500 milligrams a day. And taurine powder, which is 300 milligrams a day. And melatonin, that's something that you want to take at night, especially if you're a dipper or a non-dipper. That's something that we will find out in the clinic. What I mean by dipper, does your blood pressure go lower at night or does it rise at night? Those are the best supplements to take to lower blood pressure. And so here's what I recommend. Obviously, understanding where risk is, but those are the best ones that I can recommend. If you're trying to lower blood pressure, this is where I would focus on it most.